Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing well. Good morning.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone US COVID statistic through today, January 31st. We invite you to submit any questions or suggested topics down below or at any of our social media linked in the description. Starting with that abbreviated COVID statistic, average COVID deaths per day in the last reported week was 63 daily. In 2024, the same week, we saw 396 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the general state of COVID in the US?
Yeah, well, I mean, the good news is it's so much less than the year before in 2024. So that is a very positive thing. And that's from all the herd immunity that we have from people who've had infections once or twice or whatever, more times sometimes, or they've had vaccines and boosters or whatever. So the whole thing is, tamping down. Now, as far as how we go week to week, this is the only reportable metric we have. It's really about the same. There's still a high level of virus floating around in the country right now, and we're in the middle of the respiratory infection season. We're right in the middle. So it's January and February are the worst. December it starts. March, April it starts to go down. So we're basically right on target.
Mm-hmm. And while we're keeping an eye on all of those respiratory illnesses, there was a massive VA study just released about comparing COVID to RSV and influenza. Which one is the worst? Can you tell us about some of those numbers?
Well, these are the ones we really have to worry about because they're associated with a mortality rate. Also, all of them have vaccines that can prevent or reduce the severity. The other infections we get during this season are generally much milder and rarely result in severe complications, rarely result in hospitalization, and rarely, cause death. So, COVID came out of nowhere. So it ended up landing on top of flu and RSV, which stands for respiratory syncytial virus. And so, we want to see which one of these is worse or whatever. So the Veterans Affairs, which is a massive medical system in the United States, has computerized medical records for a long time. They looked at 141,000 veterans, and they can follow them over the different flu seasons. And the bottom line is that COVID is the most severe of these and usually the most prevalent, followed by the flu and then by RSV. So, for instance, in the 2023 season, 9.1% of the patients had RSV. These are people admitted with one of the three, or coming in with a respiratory disease. 25% had flu, and 66% had COVID. And then these numbers changed in the 23-24 season to 13%, 26%, and 60%. So COVID was the winner. And if you look at the mortality rate, and the hospitalization rate, COVID basically wins. And it doesn't matter if you look at it in a 30-day period or even a longer period of time. So COVID's the worst. The factors that were associated with worse outcomes, longer hospital stays and mortality, was vaccine status. So like everybody's probably had COVID by now, but a lot of people have had vaccines. Many people have also had boosters. And if you just look at people who've had just some vaccines, probably even the first two or more, um, they did much better.
Mhm.
As the herd immunity increases, and we can see the death rate is much lower than it was a year ago, the difference in the 30-day hospitalization risk was started to disappear between COVID and influenza. And because the whole disease is getting sort of milder and milder as the immunity of everybody picks up. But still, at the bottom line is that it's the worst one, it's the most dangerous one, and it's benefits significantly with vaccines.
Mhm. And before we move on from COVID, there was another smaller study linking reinfection to long COVID. Can you quickly tell us about that?
Yeah, this is a small study from Stony Brook University in New York, and they were looking retrospectively at some 2,500 or so essential workers, most of them who were first responders, and they looked at long COVID, and it looked like nearly 85% of the people in the study with multiple infections developed some form of long COVID. In other words, they had symptoms at 30 and 90 days or even longer. So they found that there's a significant risk of having multiple infections with long COVID. You know, some people have, oh, I had COVID once, or I never had COVID at all. They may have antibodies, they may have had it, didn't even realize it was so mild. But if people that have had like multiple bouts, these are the people that are at risk for long COVID. So why is that important? Like, first of all, why are they getting COVID all the time? So even if they've been vaccinated and they're having multiple bouts of COVID, there's something unusual, about those people. So we need to study them and find out what it is. And maybe there's some way we can, prevent long COVID.
Absolutely. And we have some major public and global health stories this week, starting out with fears surrounding pauses of funding for federal programs. Specifically, we're talking about PEPFAR for global AIDS relief. Can you tell us a little bit about PEPFAR itself and some of the fears around the funding?
Well, from the executive branch of the government, there was put in a pause of basically all global health funding, withdrawal from the WHO, the immediate stop to PEPFAR. Now, PEPFAR stands for the President's Emergency Plan for AIDS Relief, started in 2004, bipartisan arrangement by Congress that is due for renewal in March of this year, interestingly. PEPFAR, I was part of PEPFAR. I was the country director for Nigeria for 6 years. And PEPFAR has saved 25 million lives. And there are 220,000 people pick up their PEPFAR HIV medications at clinics every day. And that includes 7,400 children under the age of 15. This is a massive public health program that has been highly successful. People in these countries look up to the United States and are very grateful for this PEPFAR program. It's an expensive program, but it's life-saving. To cut it off with just a stroke of a pen caused enormous chaos. And the PEPFAR sites were told, even if you have drugs in the pharmacy, you're not to distribute them. Now, people that are have a chronic disease and are on their medicine, they can't just stop their medicine. I mean, there can be an instant rebound in the disease. Think about diabetics and insulin. If you take their insulin away, guess what happens? It's not a good thing. Or any chronic disease, heart disease, and anything. You can't just stop your medicine like that. Anyhow, this caused such a ruckus, and it turns out to be maybe this is an illegal thing because this was passed by Congress. This is a congressional mandated program that's up for renewal in March. So it may not even be a legal thing. Now, the executive branch can do pauses of things, but I mean, you don't stop giving somebody life-saving medicine. I mean, come on. Anyhow, a judge overturned that order, and so everything is kind of going back again to the way it was, and they're going to have to bang this out through the courts and through Congress. So we'll see what happens. But PEPFAR it's really one of the greatest programs out there. So what happened was unnecessary and really cruel,
Hmm.
let alone life-threatening.
Yeah. I mean, how do you put a price on 25 million lives? You can't. It's
No,
incredible.
but I mean, even now, 220,000 people pick up their HIV medicine per day.
Yeah, you can't imagine seeing 200,000 people.
Yeah. So it's very unfortunate. So I hope this all works out. It's always been a bipartisan program, started by the Republicans, and very good support on both sides of the aisle. And
Mhm.
there's really no reason why that can't continue. I mean, this is and PEPFAR has actually, gotten smaller. There's other donors and more responsibilities going to the countries, but it's a slow process. And a lot of these countries just do not have the resources.
Mhm. So this is something we will keep our eyes on indefinitely while these conflicts are arising.
Mhm.
But something big going on here in the United States is that there was a historic tuberculosis outbreak in Kansas. Can you tell us about it?
Yeah, so there's a Kansas of all places, 67 active TB cases. And if you take it the people, the household members and contact people associated with those 67, there's another 79 who have what we call latent TB. In other words, they test positive for TB, but they're not experiencing right now any symptoms, which I actually had when I was in medical school and working at a big public hospital with and my test turned positive. So I took a year of medication, and I never got TB. But I could have gotten it. But anyway, if the people that have latent TB, if they take like 6 months of INH or something like that, they can lower their risk of actually getting active TB. So anyhow, this is one of the bigger outbreaks we've had since the 1950s. There were several others. There was one 2015 to 2017 where 170 active cases and 400 latent cases were in Georgia homeless shelters. And there was another one in a group of transplant patients like that. But this is actually serious because TB is uh, the largest single um, infectious disease cause of death worldwide. In 2023, TB killed 1.25 million people around the world and infected 8 million. And this is the highest number since the WHO started keeping track of the number of cases. So TB hasn't gone away. There's been improvements in the diagnosis, and there's been improvements in the treatment. Not so good with the vaccine, but it can happen in Kansas. So I mean, it's something that we have to keep an eye on, and this is why we have to stay engaged with the world to figure out, where these cases are, how people are getting it, how's the best way to treat them, because it can happen in Kansas. It can happen
Mhm.
anywhere.
And it's an absolute tragedy that so many people are dying from what is a treatable and
It's
preventable
treatable.
disease.
Exactly. It's a treatable and preventable disease.
And speaking of more tragedies, the avian flu has not slowed down here in the United States. Can you give us the updates on all that's happened since last week?
Oh, there's been so much going on. So there's a different sort of form of avian flu in East Asia. Um, there's all sorts of stuff happening in the US here. Um, so far, the virus has infected all sorts of birds, and including 136 million commercial and backyard and wild birds. And this is what has sent egg prices up so high. and it's just, and then it's in, cows get it and it gets in milk. And so, cattle, dairy farmers have also gotten infected. We have somewhere around 70, 80 human cases here, but they got it from the animals. They didn't get it person to person. So it still hasn't transmitted person to person. So that's the good news. But very locally, tragedy strikes locally in Madison, Illinois. There's a chicken farm, I didn't realize this, called Cockadoodle, K-A-K-A Doodle. And they started noticing their hens, all of a sudden, dozens died, the next day 100 died, whatever. I mean, they, called in the authorities and everything, and they had to call the entire 3,000 hens. The farm basically got shut down. And they had the farm will go in quarantine for about 6 months. So they're unfortunately out of business, and they sell locally, and it's really quite sad. They have a GoFundMe campaign, and it's just really sad. There's a duck farm in California where the same thing happened with the ducks. They had to call 119,000 birds. I mean, this is like massive. So it can be local, it can be worldwide, and so far it's still the animals giving it to a few humans. But if those mutations are happening, and if that starts transmitting person to person, then we have a new kind of flu out there. It's really very unfortunate.
Yeah, and speaking to those egg prices, even though the Madison farm is a small local farm by us, they were getting about 2,000 eggs a day from those 3,000 hens. So if you apply that to the 136 million birds we've had to have culled, I mean, that is hundreds of millions of eggs, hundreds of millions, if not billions.
Yeah.
Crazy. Whew. Now, another story we have not touched on in a few weeks here is clade 1b Mpox. There have been a few travel-associated cases popping up here and there. If you could tell us about those, and also just a quick rundown on what countries are most affected.
Yeah, clade 1b is the more serious one, and there's now the UK, United Kingdom, has reported their 7th imported case. Patient had returned from East Africa. And, it's just very unfortunate. It's still going around. There are vaccines out there. The public health program has started to kick in, particularly in the eastern DRC, Democratic Republic of the Congo, where a lot of this started. And but you can see it's oozing out into the surrounding countries as well. So, the Mpox thing is not over.
Not over, and something we will continue to monitor. But to end on a higher note today, there was some very positive news from Moderna and the manufacturing and testing of a norovirus vaccine. Can you remind us a little bit about norovirus and then about this vaccine?
Yeah, norovirus causes a serious but not severe form of diarrhea that generally is self-limited, and with just routine care, fluids and whatever, people do okay, but it's debilitating. And it's had a particularly nasty impact on cruise ships. And because it's so infectious. So anyhow, there's no treatment for it, no antiviral treatment, and there is no vaccine. But Moderna has just announced. Moderna makes all sorts of vaccines, including some of the COVID vaccines. Announced that a large phase 3 clinical trial is underway, with results expected later this year or early in 2026. So this could be another one of those things where, fewer people will get it, or they'll get it and it'll be even milder, So I think for people putting themselves at risk for norovirus, like if you're going on a cruise or you're going to a place where there happens to be a lot of norovirus, you would be able to get vaccinated. So, I mean, it's, if you go on a cruise, they're usually 7, or, I mean, they're any kind of length, but it's usually 7 or 10 days. Well, how would you like, it's like 5 to 7 of those days you're in the bathroom, and, it kind of ruins a trip. But you know, it just is another tool that we'll have to prevent this unfortunate, nasty little disease.
Absolutely. And on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise breaking down all the data and latest headlines for us. It's much appreciated.
Well, thank you, Katie.
And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. As always, if you have any questions or suggested topics, please drop them below in the comments or at any of our social media linked in the description. We'll see you next week and have a great weekend.